Welcome to Hope Health's Facebook Live. Today we're joined by Renata and Chelsea, both registered nurses at HopeHealth Visiting Nurse, and they are here today to talk to us about their role as home care nurses. Ladies, thank you so much for joining us today.
Thank you.
So can you both just tell us what brought you to home care? Why did you choose to be a home care nurse?
So for me, I worked in the hospital setting for a lot of years prior to joining Hope Health, and I had just kind of I had moved, and I was at a point where I could kind of, all right, do I want to stay in a hospital setting, or do I want to pursue another area of nursing? And I think I kind of really did some soul searching and see, why do I do what I do, and I realized that I wasn't spending the time that I really needed or wanted to care for my patients in the hospital setting, seeing how busy the floors are and all of that. So I think, so that's why I chose to kind of join, home care. Because of not only the flexibility of, in the scheduling, I think the hours are great, but also having that time to really, spend with the patient.
Connecting with the patient, right?
Yes.
It's wonderful. What about you, Chelsea?
So I came from a skilled nursing facility. I was there for almost 7 years, and it was a really busy unit. And I really just wanted to connect more with my patients and have that one-to-one time with them and their families, and kind of help them as a whole. I saw a lot of patients. We were discharging them home, and they were so scared. And part of me was always kind of, I'd love to follow them and still be there with them and see how things go. And then, I really needed a change, and I needed some more flexibility for myself, my family, and home care really kind of fit that role for me.
That's awesome. And there's a lot of misconceptions about home care nursing. Maybe that you're just going into homes and taking vitals, and that's what your role is. But it's really not true. What it really is, in fact, is using a lot of skills in the home to take care of a variety of chronic illnesses and needs of a patient. With HopeHealth Visiting Nurse, we have specialty programs like palliative care and Hearts at Home, our cardiac program. Do you want to talk a little bit about your role and the skills that you're able to use as a home care nurse?
For me personally, we do a lot of palliative nursing, which is great for people who have chronic, life-altering illnesses that really need some guidance. A lot of the times you're in the hospital and you get this new diagnosis of heart failure or cancer, and then you're just kind of sent on your way to navigate through the healthcare system, and it's so overwhelming. And not only are you trying to navigate through that, but you're also trying to do it not feeling your best. And palliative nursing is really great to kind of help both the family and the patient as a whole make the right decisions for them, not for anybody else. And it's been really nice doing that. And then, a lot of home care nursing is more than vitals. We're going in and doing wound care, wound vacs, IVs, chest tubes. So you're still using a lot of your nursing core care, and a lot of education too, which is nice.
Yeah, and I think to just touch upon the Hearts at Home program that we have, it's a fairly new program, but I think we've gotten a lot of positive feedback from the community and our staff too. It's a program focused on congestive heart failure patients who are discharged from the hospital, and we follow them very closely with a lot of visits, between nursing and then therapy, whatever the patient needs, we're there to support them. The palliative program too, for those who are most at risk. And to really, focus on teaching them what it's like to live with heart failure. It's a chronic disease that doesn't have a cure, and they just have to really learn how to manage, themselves at home with diet, lifestyle changes, their medications, making sure they understand, all the medications and, how to live with that disease. I think it's a great program. It's really, focused on trying to keep patients out of the hospital setting and at home,
Helping them heal in the place that they're the most comfortable, and then you're able to be in their setting and see, what's in their fridge or what's on their shelves, and teach them about, what they could be changing to keep them safe and keep them healthy and staying, in their best setting. Now, as home care nurses, you're really kind of independent. You're going home to home on the road, but you're also part of a bigger team. Can you talk a little bit about that?
Yeah, I mean, just yesterday, I went into a patient's home who had fallen and had new skin tears, and we have a wound nurse, and right away I could call her right on the phone and say, what do you recommend? This is what it looks like, and schedule for her to come out for a visit. But instead of having to wait and having that gap in care, you know, she was able to recommend what she thought would be best. You know, we have physical therapists, occupational therapists, we all work as a team. They'll call me, email me, let me know if they notice anything in between my visits, and I vice versa if I notice something. Our management team is great. We always have somebody we can call if we're ever in a home and need advice right away and it can't wait, which is nice. And then the nurses, we all work together as well. We're all there supporting each other through our days. You know, any questions, concerns, phone call away.
That's awesome.
Yeah.
It's a really great supportive environment where, you know, even though you are providing kind of your autonomous care, but you're also part of a team that can support you and give you that guidance if you need anything. Now you both came from different settings. You know, you came from the hospital, you came from long-term care setting. You didn't have necessarily experience in home care. What did HopeHealth Visiting Nurse do to kind of onboard you and teach you, and what do they do to continually teach you and keep those skills built up?
I felt like the training experience at HopeHealth was the best I've ever had at any facility. I know a lot of nurses going into new facilities, sometimes they don't get the training they need and they rush to get the nurses on the floor because they're short-staffed and they need nursing. And I didn't feel rushed at all with HopeHealth. They really took their time. We sat in the office for a while. I met with the nurse one-on-one for a few weeks. Then I went with an admission nurse, the wound nurse, and they really listened to my concerns and what I felt like I needed more time with. And they never made me feel like I couldn't speak up and say I needed more time. And you know, and sometimes even when you're done training, you realize, oh, I really don't, I need more with that. And you're able to let your manager know, like, I think I need a little bit more training in this. And they set it right up, which has been really nice.
That's great. What about you with you know, skills building throughout your time here? What's your experience with that?
Yeah, so I mean, we have a skills sphere, you know, where we get training, you know, for different types of you know, skills that we might need in the home setting. And you know, in the home care, I've actually done a lot more different skills, a variety. You know, such as pleuroextreme, the wound vacs, and so we get training on ostomy care and all of that. So we get it throughout the year, and even, you know, as needed. You know, there might be something like a pleuroextreme that you don't see a lot for a while, and then you get like 3 patients on it. But if you can always get a refresher, you know, you can go out with the nurse and, you know, do a joint visit and watch it being done, accessing a port, IVs, all of that you might not. Some nurses come from backgrounds that they've never even done IVs or accessing a port, but they, you get the opportunity, you know, as it comes, and we do get training on it, and you only, you know, do it, you know, even blood draws through, you know, line. Nurses don't draw bloods in the hospital, you know, so, you know, if you get the opportunity, you can just get trained on it, go out, do it, so it's nice, it's nice.
That's awesome. And what is your favorite part of being a home care nurse? Can you share a little bit about that special piece of being a home care nurse?
I think just getting that one-to-one time and really getting to know the patient on a different level. You know, they're not in the hospital, you work in their home, and that's their environment. And for them to welcome us into their homes and feel comfortable with that is pretty special. And, you know, we work closely with the family as a whole and kind of guide them through. You know, they come home from the hospital and they're so scared and they don't know if they can do it. And to be that extra layer of support for them, they're able to call us day, night if they need anything. And it's nice to watch them actually, you know, be able to come home and succeed. I know that we're a part of that.
Help them reach their goal.
Right.
Yeah.
I think for me the same, you know, just having, you know, that personal touch and getting into the home and really seeing the patient as a whole, their environment, their family dynamics, you know, and the different pieces that might impact the health that we might not see, you know, during a hospital stay, which is, you know, sometimes all, you know, very short and rushed. And being able to just teach them that, you know, it's okay, you have this diagnosis, but we're here to help you and support you, you know, what are your goals, and let's, you know, work towards that, so.
Yeah. Well, I mean, it just sounds like your roles, you know, are just such a vital part of the community, and it sounds like you're really able to have that one-on-one time with your patients, and it's really special. And actually right now, HopeHealth Visiting Nurse is hiring RNs and LPNs to join their home care team, and actually offering a 10K sign-on and retention bonus. So if somebody's listening right now, hearing all the special parts of your career, and they're thinking they want to join, what's something that you think you want to tell them about why they should join HopeHealth Visiting Nurse and their home care team?
I'd say go for it. You know, I don't regret my decision. I was nervous, but I really love it. You know, I love working for HopeHealth. The team atmosphere, the independence, the flexibility has been really beneficial.
I say the thing, just, you know, give it a try. I think it doesn't hurt. I think go for it if you really want to feel like you're making a difference in the community and the patients that you serve. You can't go wrong with home care. And I think HopeHealth specifically, you know, I agree with you 100%. It's a great team effort. Also, you know, don't regret my decision. I think it's not easy, you know. I think with any role in nursing, you know, that you're going to join if you've never done home care, there's going to be, you know, that transition period. And I think all of us go through that, any type of nursing you go into, but I think with the great support of the team that we have, you know, you can go anywhere.
You can excel.
Yeah.
That's awesome. Well, thank you both for joining us today and sharing your experience. It's really been great to sit down and chat with you both. And if you listening are interested in joining our home care nursing team, you can visit us at hopehealthco.com/careers. And I'll also leave a link in this post so that you can click and apply for our home care nursing positions. We look forward to meeting with you. Thanks and take care.